Hello everyone, I'm Rachael Lowe from Physiopedia. Today I am talking to Dr Mike Landry. Hi Mike.
Hello, how are you?
Good, thank you. Thank you so much for joining us today. I would like to talk to you today, Mike, about your experiences of global health. I know you've done a lot of work in the field. I know you have written a course, or you'll be delivering a course soon on global health. So I'd really like to just explore your opinions on what you think global health is for our profession. But before we do that, maybe you could just quickly introduce yourself to people so they know a little bit about who you are and what you get up to.
Well, yeah, sure, no problem. Thank you so much for this. And I do applaud the efforts because I think global health really is not necessarily about only an international context. We have a bit of a saying here at Duke that we're going to be coining, which is local before global, or think locally through to the global connection. So my name is Mike Landry. I'm a Canadian physiotherapist. I'm now the division chief here at the Duke Doctor of Physical Therapy Division in Durham, North Carolina. And I'm really pleased to be able to contribute to this conversation because I think global health really represents a new and great opportunity for us. But again, I think we need to keep in mind that the context here is about health disparities. It's about social justice and not just about, folks oftentimes from the wealthy world somehow managing to get to a lower resource country to contribute, because there are certainly dangers that are inherited with that. I think courses such as the one that you're going to put on, maybe the one that I'll put on, and the diaspora around the world of PTs getting involved in global health will actually solve many more problems than we have in the past, because we need a fair amount of humility prior to engaging in these very complicated scenarios. I often go into these global health discussions or even global health deployments, assuming that I'm going to do more harm than good, and then I need to prove myself wrong. So I think we really have to be conscious of our efforts, and that sometimes in our best efforts, sometimes things go wrong. So we have to be really careful that we do things the right way.
So, very interesting. Let me ask you about the global health deployments that you've been on, just so that we can have a little background of that and your experiences of going on their deployments. And then maybe we can come back round to the fact that global health isn't just about those sort of situations.
Mhm. Yeah, most of my experience actually in global health has to do with post-conflict and what's called sudden onset disasters. I'm currently a WHO consultant working with the emergency medical teams in Geneva. So really my career started about 22 years ago in global health, being deployed inside of the besieged city of Sarajevo and across the former Yugoslavia. Where it was, in my view, one of the first times where rehabilitation became an important factor, because there were many more survivals than there were casualties. And in Sarajevo, if you recall, and you need a little bit of gray hair like me to recall these days, because we are talking more than 2 decades ago, you had a city that was under siege, and you had civilians who were severely affected and couldn't travel from one side to the other. And so this began a whole new process, and I do have to give credit to Queen's University, and Malcolm Peete, one of the great PTs in this field, who was part of the architects, along with many others across the world like Padmani Mendis in Sri Lanka, who created the essential formulary of what we now know to be community-based rehabilitation. So for many years, I've been involved in disaster and conflict zones. And so I think that's somewhat different than we think about development or humanitarian aid and long-term development. So there are many different aspects of parts of the discussion as it relates to global health. I can contribute, I think, in one area, and there's certainly many more people who are more informed than I am in terms of the long-term development processes and the roles of PTs.
All right, if you've brought up the role of PTs, what, in your opinion, what do you think the role of PTs is in global health?
Mhm. Well, I actually think it's very similar to our role in any other community. The only difference becomes oftentimes, again, in my experience, is the acute nature of either a sudden onset disaster, such as a earthquake in Nepal, or a conflict zone, such as Kabul in Afghanistan, where another one of the great PTs of our time, Alberto Cairo with the ICRC, has been involved for over 33 years. So there are those who contribute to global health, and then there's people like Alberto Cairo. So I think in a conflict zone, what happens is it's fairly easy, and I say that very carefully, but it is fairly, compared to the past, it is fairly easy to preserve lives with quick action in terms of deployment, with very easy access to antibiotics, better techniques as it relates to amputations, as an example. So it's one thing to preserve a life, but it's another thing to ensure that that life has some quality thereafter. And we saw much of this evolve over the last 22 years. So you have a transition between high mortality to now high morbidity. And with that high morbidity creates an opportunity for PTs and other members of the rehabilitation team, including occupational therapists and physiatrists, to truly participate in saving lives and saving life. Slight difference in saving lives, also in saving life among those who've been preserved. So I think right now is one of the finest times to be a PT considering global health. I actually, this morning when I opened up my email, I had an email from an alumni, a student from a few years ago, who was now purposefully wanting to be involved in global health. And for the first time ever, we actually have career trajectories that these folks can actually engage in. And so global health is actually part of our future. It's part of a viable career trajectory and ladder for PTs. So it's very exciting.
Yeah. So you talk a lot about, and from your experience of going to post-conflict zones and areas of disaster, so acute areas in disaster situations, and you've talked about how, we have that role to preserve life, to make a good quality of life for people that are survivors or are managing to get through in those difficult times. And that's a really, that's a really obvious role for the physiotherapist, because it just draws on the skills that we have and taking them to a different environment, I guess, and helping people at a point in time when they're in need. But you've also talked about how we should start locally before we move globally. You mentioned that at the very beginning when you started talking. Can you just talk a little bit more about that and how our role may be there?
Yeah, no, I think your point is a very good one. Even in acute scenarios, even in sudden onset disasters, it must be at the forefront of our minds of how our involvement, our engagement creates sustainability. And it's very easy to say, well, therefore you would just find local PTs and train them. And much of that is true. I mean, it's very rare. And by the way, I think WCPT has done a marvelous job at scaling up education around the world. And Physiopedia, if you don't mind, I'll put a plug. I mean, you've played a very important role in this one, because around the world, PTs of all economic income levels have access to information that they never did before. And so that's an important aspect of what we see today and a real stimulation for change in the future. So when we enter into, a very difficult situation, we must right away be thinking, what is the sustainability of this engagement? As I say, when I go in, this is a personal matter. When I go in, I assume I'm going to do more harm than good and then need to prove myself wrong. And so we need to be able to right away engage with our local community of providers and PTs in particular in this case to ensure that we've involved them right from the start. Oftentimes later in the process, even in acute disaster response, we, at least in the past, have complained that, oh my goodness, how do we transition and the system wasn't ready? Well, oftentimes it's not ready because we didn't include them from the beginning. So as a starting point, we must include them from the beginning. I'll tell you a very quick story that at least helped me understand this. And this was in Haiti, just after the earthquake, and I was working with a team from the Toronto Rehab Institute. And we specifically working on or with people who had spinal cord injuries in the north. And it was a particularly difficult day. And there were no Haitian PTs at the time with us, but there were some nurses. And after a particularly difficult day, we were sitting down having a drink, and this one nurse, Haitian nurse, said to me, "So, what kind of earthquake did you have in Canada in this case that you have all this experience in spinal cord injury?" And only then did it dawn on me, we in at least North America and Europe have had experience from World War II as it relates to spinal cord injuries. At that moment when she asked that question, Haiti had had 2 weeks of it. So we have to understand that education is a key to success, it's a key to sustainability, but the context through which the education happens is also important. And so we have to think really broadly of not just educating, but communicating and partnering with local institutions of whatever sort they are.
And then, so again, we're talking again here about in conflict areas or sudden onset disaster areas. For physios that are unable to, for whatever reason, go to those situations and want to get involved in global health at home, is there a way to do that at home?
Yeah, again, just brilliant question. I think there are those who have the aptitude and maybe the chance to be able to, travel and work internationally. But I think the number one step, and if you think of scaling up across one's own career and one's own thought process, it really starts at understanding what health disparities are all about. It really starts with understanding about vulnerable populations who may not be able to access care. If you look around the world, in Britain and Canada and the United States, people who have disabilities have quite a difficult access point. Now, that level of access is amplified in a low-resource setting oftentimes. But I really think what PTs should and need to do is, think locally, act locally, think broadly about what the impact of your involvement will be. Gain some experience in the local context as a preparation for the next level, which will be global. Here, that's only of those who might have the opportunity and the aptitude. What we're doing here at Duke is creating opportunities for our students to indeed do that. So create opportunities in their formative years to act locally, involve in the community, involve in disenfranchised populations. Should they do well, should they be able to really scale up their aptitudes, then bring them to a next level. We need to really create that trajectory over time such that the outcomes are going to be much more standardized, and so that we don't really mess up communities like people of my age have done over the years. We can do better, and we must.
And so what I can hear you talking about is that global health is really about contributing where there's health disparity. And that's anywhere, isn't it? And in any situation. Although we think about global health as low income, low resource countries, that isn't the case, is it? There is health disparity in all high income countries as well. And I think it's trying to get our heads around understanding that global health is in high income countries as well, that we can act at home. Would that be fair to say?
Yeah, absolutely. If I took a baseball, or in my case, probably a hockey puck, and shot it about 7 times from where I'm sitting here at Duke University, one of the top universities in the United States, I would be in a community that has as poor determinants of health and social and health outcomes as many parts of sub-Saharan Africa in this city. And that should upset us, and it just doesn't move us to action as much as I would like to. So I completely agree with you. I think this is an issue. Global health is by definition social justice. The term we used to use, which is international health, which meant essentially people from high income countries going to lower resource settings, and it invokes notions of overseas development, et cetera, there's a role for this. But when we invoke the very nomenclature of global health, It is about our own community, and that what happens in a community in parts of sub-Saharan Africa or East Asia impact us. We only have to think a few years back about the issues around SARS, or even more recently around the issues that happened with Ebola. And so we need to be, driven to start to understand what global health really means. And what it really means is that if something happens elsewhere, it should matter to us. And if something happens in our own backyard, it matters to somebody else.
And I guess it's being able to notice these things the difficulty to us at home is being able to notice where these health disparities are and where we can have an impact on the social justice, isn't it? And I think that's going to be quite a skill, and that's as we learn more what global health means to our profession, I think that's probably going to come out more and more, and we'll definitely change our thinking about our role in that sort of arena.
I agree. Our role also, I truly believe this, and it's not just PT, but it would be all of the whole diaspora of rehab professionals, is that we have in our ability to advocate on behalf and alongside people who have disabilities. And that really is our calling. And this is an area that we could do a lot better, and we need to. We need to really dig deep. We really need to understand how we can be mediators and moderators of change alongside people with disabilities around the world, maybe in particular in lower resource communities. And those communities can exist in our backyard all the way through to the global community. And I do very much, I hope that this course that you're putting on, there'll be so many people who will want to take it, again, to think about the level of awareness. Let's start there. Let's not expect PTs around the world to somehow all of a sudden want to be Pete Skelton and others, who are fantastic out there. But let's start with that level of understanding, the awareness level, and then go to another level of understanding. So I think the course that you're thinking of, and maybe the one that I'm putting on, and the ones that are happening around the world, are important first steps in making a difference down the road.
Yeah, so definitely. And I think, so our course is a short course. It's very short. We are hoping to, through the end of the course, help everyone have an understanding of a physiotherapist's role in global health. And it's a fairly short course, and we'll just be discussing it amongst the community that join the course. And my recommendation to everyone that's been on this course that would like to do more would be to go to your course next. So just tell us a little bit about your course that you're running soon.
Yeah, the course that I'll be running is, it takes a bit of a deep dive in terms of the intersection between global health, rehabilitation, and disability. So it's actually called Frontiers in Global Health, Disability, and Rehabilitation. And what we will be doing on this free MOOC, this Mass Open Online course, is really, targeting not just PTs, but health professionals and people with disabilities around the world to do that first step of, okay, what is disability? What is the role of rehabilitation in a global context? And then, understand what are the right steps to follow? What are the first few steps, and what are the long-term steps that we need to be considering to be effective and to truly develop strong partnerships around the world?
Yeah, I think.
So, yeah.
Yeah, I think, honestly, I really think that our little introduction will spark some interest, hopefully. I'm really hoping, and that we can direct some people towards your course as well. I think your course will go into far more depth, and bringing in the disability and rehabilitation aspect is really lovely as well. So that's great. I hope that yep.
The next extension, and so I've really enjoyed our talk, because we're talking about building blocks, right? Career ladders, evolutionary thought. So, for instance, after my course, what we're hoping to do is around the world have these immersion opportunities for PTs who want to be involved in global health under a strong mentorship environment, such that they can learn and apply some of the skills and knowledge that they have just learned in a theoretical framework. We're also hoping across the world that we can start multiplying efforts in global health, not just adding. A quick example, just this past week, we held a simultaneous stroke camp. So here in Durham, North Carolina, and in Jamaica, same week, same time, same protocols, all for the purpose of trying to bend that curve of disabling function among people with stroke around the world. So there are really important aspects that PTs can be involved with. It's just a matter of creating the right opportunities and the right scaled up opportunities.
Yeah, I think that's really nice. I do think it's important to start that we have to form the basis of an understanding of what our role is in global health. And to do that, we need to understand what global health is. And I think that's the position that our profession's in at the moment. So with the learning that you and I and our teams can deliver, I'm hoping that we can sort of consolidate that understanding, and therefore we will feel comfortable with people moving on into those positions of experience where they can really make an impact. Now, Mike, I'm really aware that you haven't. I'm really aware of your time. And I know that you don't have much more time. I'm really grateful to you for speaking to us today. Is there anything that we haven't covered in this short conversation that you'd really like to mention?
All I'd like to mention is that I've been waiting 15, 20 years for these types of conversations, and I'm really glad around the world that they're happening. And that's really heartwarming for me as a professional who's been involved. I'm just excited to see where this all goes in the next 10 years.
That's great. Mike, thanks so much for talking to us today. We look forward to a future where we can develop some global health practitioners in our profession.
Well, good luck with yours, and all the best to you all.